It's time to talk about health matters on Channels Television. Welcome to the show. I am Yomi Otaigbe. A few days ago, World Diabetes Day was marked globally to call attention to and create awareness on how to beat diabetes mellitus. The World Health Organization says the number of adults living with diabetes globally since 1980 has almost quadrupled to 422 million. Figures for Nigeria is around 1.5 million. What are the risk factors for diabetes? How can it be prevented and managed where possible? Today I have with me in the studio a consultant endocrinologist who is also the medical director of Rainbow Specialists Medical Center and project coordinator Diabetes Podiatry Initiative, Nigeria, Dr. Rita Isiawe. Thank you so much for being here.
Thank you, Yomi.
Okay, we're talking diabetes. A lot of people, when you mention diabetes, they think sugar. So, what is diabetes?
Well, diabetes is a chronic medical condition. And when I say chronic, that means it's something one has to live with for life. Unlike your malaria and catarrh that you just treat for a few days, for diabetes, you're talking about a life situation. It's a disorder in which the body cannot handle sugar, you're right, either as a result of no insulin or the insulin not functioning well.
Okay, so the body basically can't handle
sugar from the food
sugar from the food
yeah.
taken. Okay, no. Now let's talk about the types. You've said whether it is as a result of lack of insulin or the body not being able to use up the insulin. Let's talk about the types one after the other.
Okay, there's several types of diabetes mellitus, but there are three main types. You have type 1, type 2, and then gestational diabetes mellitus. The bulk of the people we'll see in this environment are the people with type 2 diabetes. Type 2 diabetes accounts for over 90% of the people living with diabetes. For type 2 diabetes, the risk factors now are if you have a family history, if you're overweight, if you are sedentary, no exercise, those are the main risk factors for type 2 diabetes.
Okay, so let's talk more about type 1. Is it in as a result of inheritance? Is it why will the body not make insulin?
Type 1 is an autoimmune condition. When we say autoimmune, the body does not recognize the pancreas, which is the organ that produces insulin, and forms antibodies or soldiers to destroy the pancreas, and so there is no insulin. You find type 1 typically in children, and then you find type 2 typically in adults. But what we are seeing worldwide now is an alarming trend where we are seeing children in their 10s and in their teens coming down with type 2 diabetes as a result of our changing lifestyle, especially in places like Nigeria. We have more children coming up with type 2 diabetes now.
And why?
Because of obesity. In those days, Yomi, in school, you don't only talk about one fat boy in school. Now you go to most schools, you have a lot of children who are overweight. So one of the problems is obesity. And the second is our diet has changed, isn't it? Our diet has changed. So. More children take processed drinks and juices to school than water. More children take fast food than they were taking in times past. And worse still, the schools we have today in Nigeria, many of them don't have sports field. So the children can't even run around. Even when they are teaching health education.
Especially private schools,
Especially private schools. And when they're teaching health education, guess what? When they're teaching physical education, health education, it's done in a class. That's an anomaly. Health education, physical education should be done in the field. But because of what we find ourselves in, children are not exercising, children are eating more, children are gaining weight, and more children are coming down with diabetes in Nigeria.
That's something to not to tearful.
It's not a good thing at all.
Yeah, okay, now let's talk about the other type. You've talked about type 1, which is lack of insulin. Type 2, which has to do more with lifestyle. What about gestational diabetes?
Okay, gestational diabetes is diabetes that is first diagnosed during pregnancy. Now, the risk factors, if you have a family history of diabetes, family history could mean a father, a mother, a brother, a sister, an uncle or an aunt or a grandparent living with diabetes. That puts you at increased risk. If you're overweight and pregnant, that puts you at increased risk. If you are African, that increases your risk of coming down with gestational diabetes. And I'm glad that most health centers in Nigeria today are screening pregnant women and actively screening pregnant women for type 2, for gestational diabetes. So they're picking up more women with gestational diabetes.
Okay, so having all of those risk factors, yes. Now the person during pregnancy, pregnancy itself can also predispose a woman to having this gestational diabetes. Yes. Is this something that once the woman has it, that's it?
Well,
or it's resolved after pregnancy?
I would say there is a law of a third. A third of the women with gestational diabetes will continue to have diabetes. A third of them will go back to normal glucose levels. And a third of them will remain abnormal but not up to the diabetic range. But having said this, if you have been diagnosed with diabetes in pregnancy, there's a lot you can do to reduce your chances of progressing to diabetes. Number one, cut down your weight. You know, it's kind of traditional here. When a woman puts to bed, they pamper her. She eats whatever she wants to eat. She tells you, I'm breastfeeding. She drinks pap 100 times a day, you know. So if we're able to manage that with physical activity, you will reduce your risk of coming down with type 2 diabetes.
That's after the pregnancy?
After the pregnancy, yes.
Okay, now let's talk more about the symptoms. Is it the same symptom for type 1, type 2, and gestational?
Generally, we have the classic symptoms of diabetes, okay? But for type 2 diabetes, which is what we would see, over 90% of the diagnosed cases of type 2 diabetes worldwide make up the population of type 2 diabetes. Type 2 diabetes, it is said that half of the people with type 2 diabetes do not know they have diabetes because generally no symptoms. That's why it's called the silent killer.
So it's one of the silent killers.
It's one of the silent killers. So you probably pick them up at the eye clinic when they've gone to go have cataract surgery.
When complications are
setting in. Or when they're having dialysis, or when they already have ulcers that are not going away. So the lucky ones will have the classic symptoms. And the classic symptoms, polyuria, that's frequent urination, increased thirst, and weight loss. So those are the three classic symptoms, and of course, in the background of increased appetite.
Okay, increased appetite.
Increased appetite, increased thirst, increased urination, and weight loss. So by the time you see a child who was previously continent, who starts bedwetting for no reason, and the child is overweight, then if you're a parent, you need to have your child checked for diabetes, because that's what that's a common way the children would present. And then for adults, they would be very thirsty, drinking plenty of water.
We have on the screen the main symptoms for type 1 diabetes. We will be thirst.
Yeah.
So as you say, drinking
water, very
water,
thirsty, always thirsty.
Urination.
Frequent urination, waking up several times at night to pee. Yeah.
Weight loss.
Weight loss.
Tiredness. Blurred vision.
Blurred vision. And now these are like the Malay, weight loss, tiredness. These could pass for symptoms of malaria. So another advice I would give is when you go to the hospital, if you are in Nigeria and you are over 35 years old, you go to the hospital for whatever reason, you're having your blood pressure checked, ask for a blood sugar check. Because we know the age group that is at risk in developing countries is age group 35 to 64 years, which is our workforce, our breadwinners. Those are the people at highest risk. So you ask for a blood sugar. If you are on admission for any reason, the hospitals now, make sure you screen patients you are admitting for blood sugar. It's a simple test, it's inexpensive. You have home glucose devices now that are portable that you can actually use anywhere and everywhere.
So it's just a prick,
just a finger prick
on the hand. Okay. Yeah. Now, this diagnosis, sometimes people just, as you say, some of the symptoms can go for others. And so when you go for this diagnosis, is it once and for all? Once it's detected, that's it?
That is for diagnosis?
Yes.
If it has been detected, like I said, diabetes is a chronic condition. It's something you have to learn to live with for life. It's something you have to learn to control, okay? Because the fact that you've been diagnosed with diabetes is not a death sentence. You can actually beat diabetes. You can actually reduce your chances of coming down with the complications by adhering to what your doctor advises you to do.
And this process is, to me, it would seem like it's not so painful.
It's not painful, and we have modern devices nowadays that would
that can give the results almost immediately.
Even the pricking devices now, you don't even see the needles. There are devices now that are very child-friendly and so not as painful as the classic lancets that we used to use in the past. So when will
it be the time to screen for diabetes?
Every time is right to screen for diabetes. But I would say once you are over 35 years old and you are African, you should start having an annual check for diabetes. If you have any parent that is living with diabetes, then you should take your checks more seriously. If you have a parent or a grandparent or a sibling living with diabetes, you should check more often. And then for children, if you have a child that is obese, then when you take your child to see the pediatrician, ask them to do a check for your child as well.
And as you say, it could be a kit that you can also have at home.
Oh yes, and they're quite cheap. We have different types in the market now. You can get a glucometer for as low as 4,000 or 5,000 to more than that.
So that you don't have to go to the hospital every other time.
It's like your hand phone, your phone. So depending on the applications and the settings of the glucometer, it gets more expensive as you have more applications on the glucometer.
So when will it be the best time to do the check?
You can do fasting, that's fasting 8 to 12 hours of not eating. But if
that is from the previous night?
From the previous night.
Let's say around, if you have to eat that late, around 10.
If you had your dinner at 10 p.m., then you must wait for 8 to 12 hours before you do the test. Now, if you have eaten, you can still time it. If you have eaten, then you would have a random, what we call a random blood sugar test. So a random blood sugar test of greater than 10 millimoles or 180 milligrams per DL is a suspicious figure. In fact, it's diagnostic of diabetes if the person is symptomatic. If the person isn't symptomatic, then that individual will be asked to come back for a fasting blood sugar.
Sugar.
Yeah.
Okay, to be so accurate.
Yes, and an OGTT and probably a glycated hemoglobin test.
Okay, we'll just go on a quick break, and when we come back, we'll talk more about the management and, where possible, how to prevent diabetes. Do stay with us on Health Matters.